They say that these individuals, and this is what I was talking about earlier, that these individuals that may have had the Epstein-Barr virus, okay, they can be more predisposed to having this sort of green Sternberg cell formation, which means now, obviously, they have that. These patients have the Hodgkin's disease, okay, so this type of lymphoma. So that's basically that. Okay, now, this is what it looks like here. Okay, so again, this histology slide looks different because of the type of tissue we're in. Okay, so we are now in lymph tissue, hence the coloring a little different. Now they're showing you this big old Reed Sternberg cell. Okay, so what is the situation here with this cell that looks different?
It looks like it's two that are fused.
Okay, very good. It looks like it's two fused together. Okay, so yes, you do see the two nuclei. It looks like it could be sharing the same cell, okay, but it's actually not. It's two cells sort of fused together. So this is what we call this Reed Sternberg cell. So this is definitely classic, what they do find in these individuals. Okay.
So when they are fused together, it's called a Reed Sternberg.
Reed Sternberg cell. This is a Reed Sternberg cell. And then these other kind of lymph cells just kind of hanging out there. I guess they're okay. And this looks like an Eel Centerfield on its way out. I got trapped up in there. Okay. Now,
What did you call that?
oh, I think that's an Eel Centerfield. It looks like an Eel Centerfield. Okay. But anyway, that's all right. Now, the two types, they do have a rare lymphocytic type, but then we also have what is called the classic type, which is a 95%. And they go into 4 different subcategories, which I'm going to go over with you in a second. So, early stages are usually asymptomatic. These individuals, please highlight, will have lymphadenopathy. They will have swollen lymph nodes, okay, large lymph nodes, and they're painless. Okay, they're not painful, believe it or not. Possibly fever and night sweats, I will also highlight that. Pruritus, this is itching, so they have itchy skin, weight loss, and malaise. Just to let you know, when patients do have these types of lymphomas, the cervical lymph node chain is the most common, and then the next most common place that's below the diaphragm would be the inguinal. Okay. So here's a woman here that has extreme lymphadenopathy. Okay, and believe it or not, that is not painful. Okay, it is actually painless. And so basically it's just the cells, and it just causes a whole clustering of lymph nodes in that region. Okay, and it's on the side there in the cervical chain. If this was in the front, we would think that would be a goiter. Okay, but this is on the side. Now, okay, I already told you. Once it's below the diaphragm, which is, it's less common that it goes below the diaphragm, but if it does, the most common spot is the inguinal. Okay, and that's how it spreads. Now, they use a different staging system for lymphomas as opposed to leukemia. So they use what is called the Ann Arbor staging system. Okay, and it does go into 4 stages. So here we go. I do need you to know these stages. Stage 1, they have 1 single lymph node involvement. Stage 2, they have at least 2 lymph node involvements. So you see here the cervical, and then the axillary, and then another area here around the thymus. Okay, and then stage 3, it is now going below the diaphragm. Okay, so when it goes below the diaphragm, yes, this is getting more advanced. So he has a little axillary here, and then it's going down into along the spine and along the pelvic cavity. And then stage 4, as you can see, that's not a good situation there. Okay, so it's just pretty much up and upper and lower. Okay, so above the diaphragm and below.
What did you say stage 2 has 3?
Yeah, 2 or more.
Oh, 2 or more.
Okay, 2 or more. So 1 here, here's another one, and then over here. So at least involvement of 2 regions on the same side or more. Okay. This chart is also in your book, just to let you know. I'm not sure what page, okay, but they also,
228.
what is it, 228, thank you, 228 in your book. Okay, so you can get a better view of that. Okay, so Prognosis and treatment. A is going to be the absence of clinical symptoms. B is here when they do start having symptoms at the staging, present at staging. So they'll have fevers, the weight loss, all the things that kind of go along with these different types of leukemias and lymphomas. One thing I do want to point out, only lymphomas, these individuals have night sweats. They don't say in your book that patients with leukemias have night sweats. But just from my understanding with, just a little bit of clinical knowledge that I do have with some cancers, the way I was taught was that night sweats is usually one of the indicators that people do have cancer. And that's for any type of cancer. But for some reason, in your book, and I'm just saying this for test purposes, not to confuse you, I'm sorry. Not to confuse you, but just for test purposes, night sweats will be for lymphomas, okay? But when you get in the clinical world, I believe that night sweats is across the board for any type of cancer, okay? Okay, CS stands for clinical stage, and that is based on the history, physical examination, non-invasive procedures, so if a person has any type of imaging done or something like that. PS stands for the pathological stage, and that's going to be any invasive procedures that are done, so like a biopsy, a bone marrow transplant, but any type of biopsy that is involved with this.
What is CS?
Oh, clinical stage. CS stands for clinical stage. PS stands for pathological stage. Now, treatment for this is different. If this patient is at a stage 1, which means they have one little lymph node that's involved, they will have radiation therapy. That's the common treatment. But if they have more disseminated or what is called metastasized type of involvement with this, they have to have chemotherapy. Okay, so make sure you know the difference. Now, the last one that we're going over is non-Hodgkins. Okay, so we went over Hodgkins and now this is non-Hodgkins. Just to let you know the difference between Hodgkins and non-Hodgkins, non-Hodgkins do not have a Reed-Sternberg cell. So they don't have that funny looking cell that we just took a picture of or looked at a picture of. 95% in older adults, males somewhat higher risk than females. Again, here we go. And they say that this is, non-Hodgkins is more common in patients that do have AIDS. Not to say that it's only localized to that group. Sometimes people can have non-Hodgkins outside of that other immune compromised situation. But it can arise from BET and natural killer cells. So, prognosis here depends on the type, and they give you the indolent type and aggressive, depending on, aggressive type is obviously more a poor prognosis than something that takes a little longer. Now, viruses here are suspected to be the development of some of these lymphomas. Just please make sure you know that. Okay, so understand that some viruses can predispose patients to certain lymphomas, such as the Burkitt lymphoma and the Epstein-Barr virus. Here we go again with clinical manifestations: painless lymphadenopathy, fever, night sweats, hint, hint, malaise, pruritus. So please make sure you pay attention to the same clinical signs and symptoms that they share. Okay. Now, non-Hodgkin's lymphoma can also spread to the skin, the the gastrointestinal tract, bone, and bone marrow. They do have serious complications, and one is superior vena cava obstruction, which can be very serious, and spinal cord compression, okay? And they do have other complications like pain, infection, bone metastasis, and joint effusions, a lot of joint swelling. So the staging, I just want you to know, is the same as the staging for Hodgkin's. So when we go back to, let me just go back really quickly. For this staging process is the same for Hodgkin's and non-Hodgkin's. Okay, so I just want you to know that. So stage 1 and 2, more favorable outcomes, obviously, because it's not that involved, as opposed to a 3 and a 4. Okay, and we already know how they're going to treat this: single node radiation, more involved chemo. Don't jump up so fast. No, I'm just joking with you. Okay, no, I'm done. Okay, I'm done with chapter 11, so we can, if you don't mind shutting that off.